Walsh Protects You and Your Family presents the Singapore Parenting Festival. Join a series of 6 free webinars at Singapore's largest virtual festival for advice on your pregnancy and parenting journey, like having a safe pregnancy and delivery, getting ready for motherhood, nourishing your baby, building a special bond, ensuring your child's well-being, and giving them a head start in life. Register now. That's not all. Get awesome discounts and deals in the grand sale. Singapore Parenting Festival, proudly brought to you by MediaCorp and the Asian Parent. Scott's multivitamin gummies support your kids' growth. Dumex Do Grow, comprehensive nutrients. Try Milo with more milk and 50% less sugar. Nature One Dairy, your partner in parenthood.
Hi, good evening, everyone, and thank you so much for joining us amidst your busy schedule. Thank you for waiting, I'm sure you've had to make adjustments to your daily routine since the tightening of COVID measures. So I'm really, really grateful for you joining us here this evening. Okay, I'm just going to go through a little bit of house rules before we continue to make sure that everyone can hear us loud and clear. You will be automatically muted upon entering the webinar. If you have any burning questions which you'd like to ask, please use the Q&A box and we'll try to get through the questions at the end of the webinar. We've already got some questions coming in, so thank you so much for that. To find out more about the Singapore Parenting Festival 2021, do visit spf2021.theasianparent.com. Now, most importantly, I want you to listen to this, okay? Stay tuned because we've got something really special for you from Shopee, okay? So during the course of this webinar, all right? So keep your eyes peeled for that surprise, okay? So I'd like to begin this evening's webinar with a little short introduction about myself. I'm a wife first, so that's my loving, supportive husband in the picture there. And I'm a mother of three very free-spirited children. My daughter's 11, my eldest and my middle child, my first son, he's 5, and my youngest is 3. I'm also the founder of Just Doula LLP, where I'm a birth doula. Now, if you're wondering what a birth doula is, I empower families in labor and birth through physical, emotional, and informational, and of course, environmental support. So if you'd like to find out more, just visit my website at www.justdoula.org. And without further ado, I'd like to introduce our guest speaker for this evening, Dr. Tan Eng Loy, who is an OBGYN, or an obstetrician and gynecologist practicing at EK and EL Women's Clinic. Hi, Dr. Tan, how's your evening so far?
Hi, Jamie. Thanks for the introduction. Yep, very excited to see that we have got so many attendees. So I think looking forward to starting the talk very soon.
Yeah, this is amazing, right? We've got so many people coming in today. Now, just to give you a bit of background to Dr. Tan, he was previously a senior consultant at the ONG department in Singapore General Hospital, SGH, and he continues to advise there as a visiting consultant on obstetric medical disorders, high-risk pregnancies, and gestational diabetes, apart from his private practice. Now, this particular point I need to mention because it's so close to my heart. Now, Dr. Tan is also a strong advocate for maternal choice. And this is so important because I believe that women and parents should be empowered to make their own choices in pregnancy and birth. And I'm so glad we're betting on the same team. Thank you so much, Dr. Tan, for being with us today. So before we move on to tonight's presentation, we're going to do a poll with our viewers right now. Okay, so we'd like to know, moms and dads, okay, participate in this, all right? What concerns you most regarding your pregnancy? Now, the poll should pop up on your screens right now. So are you concerned about, health of mommy, whether it is mama's nutrition, whether you're having enough nutrition for yourself because you're giving so much to baby, or whether you can still exercise during pregnancy, maybe, the health of baby, whether the complications could arise, that could affect baby's health, delivery. What about hospital protocols? Now that it's COVID-19, will you be able to manage pain? Sometimes a lot of moms have that question for me as a birth doula as well. And maybe it could be a postpartum recovery, taking care of a wound if you're undergoing a C-section, or if you're, going to elect for a C-section, or even taking care of the genital area post-birth, or even choosing a confinement nanny. Oh my goodness, there's so much to think about, right? So yeah, I know that for me, in terms of what was most important for me was delivery, because I really wanted to make my own choices. And our poll is showing, the results are out, that you guys are the most concerned about health of baby. That stands at a 63%. Wow. Dr. Tan, do you get a lot of questions about this in your clinic?
I think it's not a surprising result, because I think most mothers, is just maternal nature. You want the very best for your child, for the baby. All right. So I'm not surprised to actually see this. And, I think which is why, I think we celebrate Mother's Day more than we celebrate Father's Day,
Oh,
a
dear.
lot of times. Yeah. And I'm speaking as a father of two. All right. But I think it's quite interesting. Obviously, I think for majority of mummies, I think health of the baby is obviously one of the most important things that they want, to invest their time and effort into.
Right. Right. Thank you so much for that input, Dr. Tan, that insight. So without further ado, let's go into your presentation today. I'm sure everybody's excited to hear from you. So take it away, Dr. Tan.
Okay. Okay, I hope everyone can see my slides. It should be showing now. All right. Okay, so when I was approached by Asian parents to actually do this webinar itself, right, I was actually given the topic, right, pregnancy and safe childbirth guide, which I've done actually many times for my patients, and also sometimes, when I was in government practice, I used to actually teach many of my medical students as well. So it's a topic that's actually quite familiar to me, all right. But of course, I think the added new thing that we have here is obviously this thing about the new norms, and I think most of the audience here, you're probably quite worried, about. I think it's been quite a stressful couple of weeks. You see news reports every day about how the COVID situation is actually evolving, right? And I'm sure, many of the parents here, mothers to be, are obviously concerned about what, the new norms mean for us, all right? So I think the new norms, all right, when I first saw this, I was thinking, all right, I think we should start off by saying what is a new norm, all right? And I think, in fact, up till now, I think the new norm is still evolving. All right. For a while, we kind of settled down a little bit. We were in phase 3 in Singapore, and we thought that, well, things were getting a little bit better. We're looking a little bit more optimistic. But certainly the events over the past couple of weeks have shown that, things are very, very unpredictable. And obviously, I think there's still a lot of adjustments that we need to get to. All right. So I think we are all familiar with what we are seeing on this slide here, right? So I got this from Facebook. You can see the child actually sanitizing her hands, right, at every single opportunity, right? I think our kids are growing up with that kind of mentality, right? That you need to sanitize your hands all the time, all right?
That's probably going to be
I think in my clinic with
That's probably going to be the
yeah.
first gross motor skill that they actually have when they go to kinder, right?
Yeah. Yes, and you can see, certainly, I think we are no strangers to the safe entry. I think we've all moved to using trays together. You can see, that terminal that I have my clinic down there. I think all of us are, at one point in time, people are rushing, to buy all the masks they could, right? You can see the picture down there, people hoarding toilet rolls, right? And certainly, home-based learning, working from home and all that. And working from home is not easy, as you can see, right? If you've got children running around the home, right, and you're trying to concentrate on your laptop, trying to do work, to try to attend a meeting, right? And certainly we've seen the crowds at the supermarkets, right? I think there was a bit of a report over the weekend saying that people were concerned again and rushing to the supermarket. So I think these are the things that, we are, kind of getting used to, right? Still a lot of adjustments to make, but certainly I think this is kind of new norm, at least for, now and probably the immediate future. Now, so with that, certainly, I think preparing for pregnancy, the new norm, right, has taken some new directions, right, because of what we need to do, all right. And certainly, I think working from home itself, there are some benefits, all right. Okay, I think for those of us who already have children, we do find that things are a bit stressful, right, because you need to juggle everyone at home, you need to juggle your work, right, and your children, all right. But certainly, I've also seen couples coming back to me, all right, for repeat, for a second pregnancy, for a third pregnancy, or some mothers, right, coming because they found time to actually, conceive, right, while they are at home, right? You can't travel, you're at home all the time, all right? So, some couples that come to me with new pregnancy. So we do see, interestingly, I think some couples coming to us, getting pregnant and all that, and obviously seeking pregnancy care. Now, of course, the disadvantage, as I mentioned, right, quite a few of them, right, the stresses of being home, all right, you need to really adapt, to working from home, doing everything at home. And certainly, I think for some of us in society itself, because of the new norms, right, some of us may have actually lost our jobs, right, finances can become a problem. So it's a bit of a headache. So it's always a dilemma. All right, and I believe that there was a survey that was conducted by the ministry, by one of the government ministries that basically, wanted to explore, right? You know that the birth rate is always a very important topic, nationwide, right? There's always this fear, right, that our birth rates are, quite abysmally low. All right, and I think the ministry actually did a survey, right, trying to find out from parents to be or parents who may have intended to actually have a second pregnancy, or third pregnancy even, right? Whether if the COVID situation has actually made them change their plans, right? And I think in that survey itself, 3 out of 10 people have basically said that, yes, it has actually altered their plans, right? And I think with the majority actually deciding that, they might actually delay, having children for at least the next 2 years or so, right? So I think that is something of concern, and certainly I think the authorities have recognized that this is going to be a problem, right? I think I like to tell many of the mothers that I deliver, that it takes a village to raise a child, all right? And I think certainly, having that social support is important. Now, monetary wise, is obviously another big consideration as well. It takes a lot of money to actually raise a child, to start a family and all that. I think to that, I think the government has actually come out, with quite a good support. So I think this was taken from the Straits Times last year, right? About the one-off $3,000 baby support grant, right, for Singaporeans born. Now, I mean, the current time period is dated from October 1st, 2020 to September 30, 2022. I'm not sure whether that might be extended, given the situation that we might be going through, but at least, kind of a bit of a support coming from the authorities with regards to that. Now, I think just before we started this webinar itself, I saw someone actually asking in the Q&A, right, talking about vaccinations, right? So
that's right, yeah.
I may as well just address this topic, right, since we are on this slide itself, all right? So I think the vaccinations, all right, when we're talking about vaccinations, I think it's important to basically be aware, all right, that all pregnant women, even before COVID itself, we were actually starting to recommend that mummies actually go for 2 vaccinations, right, which will actually protect themselves and their babies, right, during the pregnancy journey itself, right? And these 2 vaccinations, we are talking about the common flu, not COVID, all right, just the common flu, all right, as well as what we call whooping cough, all right? Sorry about that, all right? And these are good vaccines to have, right? I think the important take-home message is that both vaccines are safe in pregnancy. Why we offer the flu vaccine to pregnant women is because of the fact that mummies, when they catch the common flu itself, right, they actually are at higher risk of falling sick, right, much more, in a more serious condition compared to someone who's not pregnant, right? And taking the flu vaccination will help to protect mummy against this risk itself. Now, for the whooping cough vaccination, is a matter of actually protecting the baby, right? Because I think the majority of us, if you're Singaporean, I think in many countries as well, right, we do receive a whooping cough vaccine, right, when we were children, right? But for the baby itself, the baby will only receive its first vaccination at around about 3 to 4 months of life, right? And the idea of giving the whooping cough vaccine to mummy is to make mummy actually produce a new set of antibodies, right, so that they can cross over to the unborn baby, and so that when the baby is born, for the first 3 to 4 months, right, even without vaccination itself, the baby is given some protection. And whooping cough, we know in very young babies itself can be quite serious and sometimes potentially life-threatening, right? So these 2 vaccines are meant to actually protect both mummy and baby. Now, of course, the pertinent topic, in this time is with regards to COVID vaccination, right? I think a lot of uncertainties about safety. Certainly, I think there's some guidelines suggesting that pregnant mummies can actually receive the COVID vaccination. I think locally, I think our guidelines have suggested that as a matter of caution, right, they would actually refrain from actually giving the COVID vaccine when a mummy is pregnant. Right. In fact, the advice that is given is that if a mummy intends to actually conceive, right, well, recommended that both she and her partner, all right, receive the vaccination at least 1 month before they actually start to conceive. And certainly for a mummy who has given birth, right, if she's breastfeeding, I think the current recommendation suggests that she should abstain or just express her milk and discard the milk for at least 5 to 7 days, right, just as a precaution, all right. Although I think there's some literature that suggests that this is actually not a problem at all, right. So I hope that clears up the doubt with regards to vaccination. All right.
Dr. Tan, it's
Now,
quite amazing because
yes.
some of our viewers have actually taken vaccinations already, like as pregnant mothers, and you've actually taken precautions. Yeah, so yeah, that's a very pertinent point. There's another one who's asking, and this is something that I would ask as well. Do mothers have to wear a mask when they push, when they're in labor?
I think that is very, very controversial. All right. I think the situation is evolving. I think just less than 2 hours ago, I saw in the news, right, that the authorities are actually recommending masks with higher filtration performance, right, because of the fact that we are concerned about the new strain of COVID virus that's going around, whether it's a little bit more infectious. I believe at this point in time, it really depends on the hospital that you are in. I think different hospital has got different regulations, different rules and regulations with regards to, whether a mask needs to be worn. I think, of course, it sounds terrible, right, for a mummy who's huffing and puffing away to wear a mask, right? But I think as a doctor, I think I do have to respect, the infection control practices of whichever hospital I'm delivering at. And I think, they do come up with these kind of decisions, after examining all the different risk factors and all that, right? So I would suggest that for all mummies who have a concern about that question, it's probably good, right, to actually ask your doctor as well as to check with the hospital that you're going to deliver your baby in, right? So I think that is evolving, obviously, at this point in time. Yeah. Now, so I think when COVID broke out last year, all right, I remember that, people actually started shunning the hospitals, right, because they were afraid, right, of actually catching COVID. If you're in the hospital, they view hospitals as really high risk places, right? So, and obviously, I think we started getting worried because we don't want our mummies to actually miss their appointments, right, for their antenatal checkups and all that, right? So I think with this topic about how often should I be actually visiting my doctor during the pregnancy, I would advise that with the necessary precautions, try to actually visit as per normal, right, even before COVID itself, all right. And if there are any concerns, obviously it's good to discuss with the doctor, all right, particularly the important things you shouldn't miss, right, in terms of Down syndrome screening, in terms of the important scans, the 20-week scan, all right, even the 28 to 32-week growth scan. I think these are all important milestones, right, which I think mummies should not miss, all right. And obviously, I think, if a mummy needs to go to the hospital and she is concerned about catching an infection, I think wearing a mask is important. Keeping a good standard of hygiene will be very, very important as well. So I think to this question, I'll probably say that, try not to, veer off too differently from pre-COVID times, basically. All right. Now, obviously, if a mummy is pregnant, all right, and, she starts developing symptoms of a flu, right, I think it's very, very important, right, that mummies see their doctors early, all right. It may not have to be actually, the obs and gynae who's actually looking after you, but it can even be a GP. Right, because I think the risk of sometimes presenting to your obs and gynae is that there are also other pregnant mummies around as well, right? So it might be good to kind of ring the clinic for a check to find out, right, am I, safe to come, right? Or, would you advise that I go to a GP? And I think in terms of flu, as long as, you declare that, you are pregnant, right? Or if you're obviously pregnant, right, then the doctor would recognize that you are pregnant and obviously choose the treatments that are actually appropriate in pregnancy itself. So I think it's important to actually seek medical attention, particularly in these times, right? Because I think the concern is that the spread of the virus is getting out of control, right? So I think that is important. Now, certainly, I think with regards to COVID-19, if unfortunately a pregnant mummy does get infected with COVID-19, right? I think the data so far suggests that I think majority of mothers do well, thankfully, right? In fact, up to about 2/3 may not even have any symptoms, all right? Only about a third will have symptoms, right? We do recognize that amongst the third, right, actually amongst everyone who is infected, every pregnant mummy who is infected with COVID-19, right, there is a higher rate of ICU admission, all right? Sometimes just because out of caution, right? Because the doctors are worried, right? Because there's so little data that's actually available, right? Now, the good news is that the majority of mummies, even if they are infected with COVID-19, the majority actually end up with good outcomes with healthy babies. Perhaps the only ones that may sometimes be at higher risk will be the ones that might actually have coexisting medical problems to begin with. So for example, if mummy has got diabetes, if mummy is overweight, right, she's got a very high BMI, right, if she's got diabetes in pregnancy, she's got a heart problem and all that, then these mummies are obviously at higher risk, right? But thankfully, I think the majority of mummies do well, all right? And certainly the majority of the babies, right, I think amongst, the data is not a lot, even 1 year into the pandemic itself, all right? But I think currently the data that we do have suggests that, majority of the babies will not be affected, all right? Certainly there's always a concern, all right, about infecting the baby at birth or shortly after birth, right? But even then, I think most authorities have suggested that even breastfeeding should still continue, right, after the baby is born, even if mummy is potentially COVID-19, right? But of course, the necessary precautions do apply, right, with regards to proper hygiene in terms of wearing masks, and all the precautions that, we hear all the time, right? So I think these are important. Now, obviously, I think we mentioned a little bit of this earlier on, hospital precautions for COVID-19, all right? So I think it is evolving, all right? And, every day I'm getting a circular from the hospitals telling me, right, the rules have changed again, right? So the goalposts are actually shifting all the time, all right? Now, certainly, I think the latest that I'm aware of is that, right, I think mummies, when they go into labor, obviously they want, their partners to be around, right? The hubbies, their partners to be around, to give them the moral support that they need. And certainly also, I think coming from Jamie as well, some mummies would also request, the company of a doula, right, to support them, right, through that emotional journey itself, right? But unfortunately, I think due to the latest COVID precautions, right, I think there's a lot of rules and regulations about who can enter the labor ward, right, who can enter the theatre if it's elective Caesar, all right, and certainly as far as I'm aware, all right, the majority of partners and husbands that want to actually accompany mummy, right, will have to actually undergo a COVID swab testing, right, to make sure that they're negative.
That's
a swab
right.
test, yes, and mummies as well. Even the mummies, right, I think there are some hospitals advocating a swab at about 38 weeks, right, and possibly a repeat swab, right, when they're admitted. Now, for the elective cases, it's a little bit easier. If you're having an induction of labor, you're having elective Caesar, as long as you get that swab done, right, the day prior to your procedure, it shouldn't be a problem. But of course, with natural labor, it's certainly, you can't really predict when you will go into labor. So I think some hospitals have actually started, right, suggesting that maybe a swab should be taken at about 38 weeks, when you're about near labor itself, just to make sure that you're all clear first, right, and perhaps a repeat swab may be done again, right, when the mummy is actually admitted in labor, right? So I think it's still evolving, a lot of changes. It might be important, for all mummies here who are potentially going to go into, who are at term at this point in time, to actually check with the doctors, to check with the hospitals, right, where they're going to deliver their babies, to find out what the rules and regulations are, right? I think the important thing is to manage your expectations, right? Don't go into the expectation, okay, right, my hubby or my partner is going to be with me, all right, and it's a must have.
Yes,
right?
it's like surprise, right? Going prepared is important. Yes, I agree. I so agree.
So being mentally prepared is very, very important, right? And this aspect as well, right, with regards to what's happening with COVID itself, right?
Yeah. Thank you so much. There's so much
Okay,
information.
Right.
Yeah. So let's carry on. Yes.
Okay, all right. So I think hopefully this this slide is very, very long. All right, I covered quite a fair bit with COVID, right? I'm going to move a little bit, to the more pregnancy bits. All right. Okay. So we're gonna put COVID to one side. I know that's right in our faces at this point in time.
Yes.
Right. But I think let's just put this COVID aside and talk about with regards to what to expect in labor. Right. What are the differences between the things that you might expect, right, when you eventually deliver your baby. Right. So I think I was given this as a heading, right, talking about cesarean sections versus vaginal births, right? I know a lot of controversies, right? With some advocating vaginal births, right? With some saying that, no, I've had a section before, I want to go for a section again, right? And all that, right? So I think it's important to actually be aware, right, that there are risks and benefits to each of the choices, all right? So certainly with natural childbirth, I think a lot of pros that you need to be aware of, right? Now, I think most people will actually perceive natural childbirth, obviously as a more natural way of actually delivering a baby. I mean, after all, that's what nature designed, us to actually do, right? So natural birth should be kind of the default, all right? And the advantages of having a natural birth is obviously that, you know, the recovery is going to be faster, right? Particularly if this is your second or third child. So imagine you've got a younger child, well, the older child at home, right? Also would want mommy's attention, right? So the sooner you get the delivery over, the sooner you get back home. Right?
I can attest to that.
So,
I can attest to that. It's a faster recovery and also a shorter stay. Yes, I can attest to that.
A shorter stay, that all right. Yeah, but from the medical standpoint, we do know, right, that if you are successful with natural childbirth, we know that, right, you know, the possibility of having readmissions in hospital is going to be much lesser, right? So I think that is a very, very big advantage, right? We know for certain that someone who has undergone natural birth is less likely to actually require ICU admission herself, and also less likely for the baby to require ICU admission at the same time. So I think double bonus, I think, for both mommy and baby with respect to that, all right? And in general, we do recognize that vaginal births do carry lower complications rate, you know, compared to C-sections, all right? Now, there are some women, obviously, right, who may need to have a C-section for a variety of reasons, right? So some women, right, may need to opt for C-section for for medical indications. For example, right, if let's say the mummy has got a placenta that's actually blocking the way, what we call placenta previa, right, where the placenta is actually blocking the cervix, right? So in this kind of cases, because the mummy is actually at a much higher risk of bleeding during labor, right, or where the placenta is actually blocking the passage completely, right? So there's no choice but, you know, for these mummies to actually have a cesarean section, all right? There are some mummies who may actually opt for a C-section, right, because they may have actually had a very bad experience, right, with a vaginal birth previously, right? They've experienced tears, right, you know, a lot of trauma and all that going through that, and you know, so for the second pregnancy, they said, okay, fine, you know, maybe I might choose to do a C-section, all right? So that's always a possibility. Now, there are some mummies who think that, you know, C-sections may be actually safer. All right, but of course, right, I think it's important to discuss with your doctor, right? I think a lot depends on how your pregnancy journey has been going on, right? Whether you've had any pregnancy complications, right? And it's certainly important for you to explore, right, this element of safety, whether if it's truly, you know, really safe, right, to do a C-section over a vaginal birth, right? Now, there are also some mummies who are very anxious about having a vaginal birth, so this so-called fear, right, of actually pushing, all right, you know, and what the stresses might actually entail, right, of a normal natural birth, right? Again, I think it's very important to discuss with a doctor, with your partner, even with a doula if you do have one, right, to actually explore your concerns so that you know what is best for you, all right? Now, of course, there are some women who choose to have a C-section, you know, to time the delivery of their babies, right? So-called the auspicious or horoscopic birth, right? But I think that's a social indication in a way, right? As a medical professional, most of us would actually discourage against that, right? But certainly there are mummies who may actually want so-called an auspicious timing, auspicious date. And if you are, you know, one of those mummies who actually want to have this, it's again important for you to discuss this, you know, with your doctor, right? So that, you know, we can actually determine what is important, you know, what are your concerns, and, you know, how we can try to actually help you achieve that target if possible, right? Even hopefully, you know, via vaginal delivery if it's possible, right? So that can always be discussed, all right? And there are certainly some mummies who are just so afraid of vaginal birth or vaginal examinations that they choose to have a cesarean section altogether. So I think the general trend, I think, amongst most of us, you know, as health professionals, is that we would actually recommend, right, barring any strong medical indications, right, you know, unless if there's a real medical problem, most of us will actually, you know, tell our mummies that it's actually better to actually undergo vaginal birth, right, rather than go for a C-section, right? Certainly because it is well recognized, right, that most women can actually give birth vaginally with no problems, right? Majority recover well. And I think, as we mentioned in the previous slide, they recover very fast, all right? And as a result, right, of the whole process itself, they also have healthy babies, all right? And certainly a C-section is not without risks for mummies because of the fact that, you know, there's a wound, all right? There's always a concern about wound infection, right? The recovery time, you know, is higher, all right? With a cesarean section, mummies put themselves at higher risk of getting what we call deep vein thrombosis, where blood clot actually forms in their legs, right? And when that happens, if the blood clot does go to the lungs, it can be potentially life-threatening, all right? And certainly, right, accidents, although very, very uncommon, can sometimes happen during a cesarean section, right? And if the surgery is complicated, right, the surrounding structures can sometimes be damaged, which may require further repair and further time for recovery itself, right? And certainly a baby that's born via a C-section itself is not completely without risk as well, right? We know that On the very rare occasion, the baby may actually be cut, as you're trying to get into the womb, right? Majority of these cuts are very superficial scratches, so they do heal pretty well, right? But certainly we know that babies that are born via C-section, some of them may encounter breathing difficulties, more commonly, compared to someone who has delivered vaginally as well, right? So I think that's important to actually consider. And certainly we know that someone who has had a C-section, right, puts herself at risk for her future pregnancies. For some reason, some mummies may have a higher chance of experiencing a stillbirth in the next pregnancy. We know that a subsequent cesarean section, a subsequent C-section is going to be harder to do. The risks are higher with a subsequent surgery. All right. And in rarer cases, what happens is that in a subsequent pregnancy, that pregnancy's placenta may actually implant itself right into the scar where the womb experienced right during the last cesarean section. And when that scar actually, when the placenta actually grows over that scar, right, this mummy may run into a lot of complications, right, including bleeding during the pregnancy itself, right, difficulties delivering the placenta after the baby has been delivered in the next pregnancy. So this can sometimes be of major concern. And in certain cases, that we've seen, mummies may actually have to sacrifice the womb during the delivery process, right, because the placenta cannot be removed safely and because she starts to bleed uncontrollably, and the last resort, in order to save mummy's life, is actually remove the womb. Right, so I hope I'm not sounding too scary here, right? But certainly I think there are some risks involved, right, for subsequent pregnancy. So I think it may be good, it may be sometimes a bit premature to think about this current pregnancy and say, oh, let's do a C-section, right? I think I want to enjoy the benefits of C-section, only to kind of, find out later on, right, that there are implications down the road for subsequent pregnancies and subsequent children, basically.
Dr. Tan, the basic bottom line is that, just, be informed, right? Make an informed choice and know what you're getting into, right? There's no right or wrong choice. Your choice is yours, right? Yeah, but be empowered and
I think
make
at the
that
end,
choice. Yeah.
Yes. Yeah. So I mean, I put it in the last point down here. What if I really insist on having a C-section? I think what Jamie says is completely true, right? At the end of it all, I think for the mummies out there, I think it's important to empower yourself with that knowledge, right? Know what are the risks, what are the benefits. Find out from your doctor who's looking after you, right? I think arrive at the decision, right? But only knowing right what are the risks, what are the benefits, right? Before you arrive at a decision, right? And at the end of it all, if let's say you're comfortable with what you have. What has been explained to you, I think fair enough. I think most of us as doctors, we will try to support you through your choice as far as possible, right? But certainly do be aware, of what are the pros and cons with each of the choices, definitely.
Yeah.
Right. Okay.
I've also heard, Dr. Tan, if you don't mind me asking, that there's evidence that if a mother actually labors for however long, right, before she actually goes into a C-section, this is based on evidence that there is some amount of benefit to the baby that she has actually labored a little while before she actually went into a C-section. Yeah. So what's your take on that?
There is. I think I think there is good evidence to suggest that is true. All right, because I think the explanation given by some of us, as to why babies that are born through a C-section may have breathing difficulties compared to babies that are born vaginally, right, is that the fact that the baby doesn't go through that labor process, right? So there's a bit more fluid that kind of stuck inside the lung itself, right? Whereas if the mummy has got a chance to kind of go through the labor process where the baby has got some of the squeezes from the womb itself, right, it may actually try to enhance that process, right? So compared to a mummy who has gone through labor and then ends up with a cesarean section, compared to a mummy that just goes for a C-section, right, without going through labor, certainly there are some advantages, in the former group itself with regards to some of the problems that baby may actually encounter. So I think that's an advantage, definitely.
Yeah, and I bring this up because, a lot of mothers are usually very concerned about labor, especially first-time moms, right, about labor and pain, right? The constant thought about the pain, right? And maybe you could take us through that. Whether, because I think it's all about suffering versus purposeful pain, right? Is it purposeful or is it suffering? Like somebody like constantly giving you this pain for no rhyme or reason, right? So yeah.
Yeah, so I think Jamie has given me a very good, lead into the next slide, right, which we're going to talk a little bit about labor, right, labor 101 and a bit of pain management overall, all right. And I think for someone who is uninitiated about labor, right, you always wonder, right, what's going to happen, All right, you sometimes see on television, right, mummy screaming away, all right, rushing to the hospital, their waters are broken and all that. What exactly actually happens, when a mummy goes into labor, right? So I think the important thing is to understand that basically that, the mummy will start to experience regular, right, and painful womb contractions. It's a little bit like menses cramps, I think, from what I've heard from my patients, right? And then as that happens, what happens is that the cervix, the opening of the womb itself, right, basically starts to open up, right? And as that process goes on, right, mummies may complain of what we call show, right, which is a kind of bloody mucus discharge, right? The waters may break along the way. Eventually, the baby's head engages, rotates, right, and then descends through the birth canal. All right, so I think this animation shows it quite nicely, right, as the labor process. Now, obviously, things are not going to place in a matter of seconds, in this clip, right? The whole process takes hours, right? Now, more so, especially if you're a first-time mummy, right? Certainly for second-time mummies, third-time mummies, right? This process can be a lot more quicker, right? But certainly for first-timer, this process may sometimes take about, up to 10 hours or even longer than that, right? Depending, on how the labor actually progresses, all right? And certainly, I think once a mummy is in labor, I think in Singapore, the majority of mummies will be actually admitted to the labor ward, all right? In Singapore, I think the usual practice is, for mummy to actually be hooked up to a monitor. The purpose of the monitor is to do two things. First, actually to monitor the baby's heartbeat to make sure that the baby is safe during the process of labor. Secondly, the monitor allows us to actually monitor the contractions of mummy, right, of the womb, right, in mummy, to make sure that the contractions are basically at the right intensity, at the right frequency, right, for her to actually undergo, a smooth labor, right. So this monitor is useful for us, right, to make sure that both mummy and baby are well, right. And certainly, you can imagine for a first timer, you're going to go 10 hours, right? 10 to 14 hours, going through labor itself. And the womb is actually contracting, every 2 to 3 minutes, right? Each time lasting about 30 seconds or so, right? Imagine the number of contractions, the painful contractions, a mummy will have to go through, right? So certainly it's very important even before a mummy enters a labor ward, right? I normally do this with my patients when they're in the third trimester, to kind of actually discuss with them, right? What are the kind of pain relief options that are actually, available to mummy, all right? And a lot of different choices, I would say, all right? Many mummies might sometimes want to choose something a little bit more conservative at the beginning, right? Because the pains may not be as intense, it may not be as painful, all right? So there are some mummies who may want to choose to adopt different positions, right? Sometimes using, one of these gym balls, right? To kind of bounce on the gym ball, change the positions a little to actually cope with the pain itself, right? Now, certainly as the pain gets a bit more intense, right, then sometimes medical interventions may be necessary, right? There are some mummies, even at the earlier stages, they may choose to actually use the what we call the gas, right? Gas and air, I think is what we call it in the UK, right? So it's a mixture of air together with actually laughing gas, right, or nitrous oxide, right? Which, does provide, you think about the term itself, laughing gas, right? So the idea is to kind of make you, right, a little bit more
happy high, tolerable.
Yeah, happy high. That's right. All right. Yeah, but you can imagine that, holding this mask, right, trying to pass through the mask for about 10 to 12 hours may not be the best thing to do, right? Mummies get tired, sometimes they get their partners to hold it for them, but even then, right, there's always a possibility of, the gas actually leaking and all that. So that makes things a little bit difficult, right? And some mummies may then go on to have actually more advanced methods of pain relief, right? So some mummies actually go through what we call an injection or pure injection, right, which is a bit of a kind of morphine kind of light of substance, right, where a medication, right, which is commonly injected in the thigh itself. This is commonly given at, once we're quite certain the mummy is in labor. The benefit of this is that it does make mummy a little bit sleepy sometimes, a little bit drowsy, all right. So in the process, the mummy actually gets a bit of rest, right, before the pushing actually comes later on, right. Now, certainly, I think for many first timers, right, where the labor is actually long, there are some mummies who may choose to go for so-called the ultimate, right, which is actually what we call epidural pain relief, right, which is basically injection. This is given by an anesthetist, all right. So there's an injection that's given into the back, where medication is actually put into the space that's around the spinal cord, right. It sounds a little bit scary, all right, but I think the pain relief is supposed to be very, very effective, all right. And the advantage of this is that you've got a very, very long labor, then certainly mummy will get a longer duration of pain relief, right, so that she conserves all her energy, right, for the actual pushing, at the end when the cervix is fully dilated. Right, so I think it's important, all right, to actually explore these options, all right. I think the reason why I like to do it in the third trimester before mommy enters a labor ward is because, when a mommy comes to labor ward, she's in pain, right? She won't be in the right frame of mind to be listening to, all you have to say about pain relief, right? So I think this discussion is important for mommy, right? Especially the first timer who's not gone through labor pains before, right? I think having this discussion will be very important important for mummies who are preparing for labor, definitely. Okay. Now, I'm going to veer off a little bit from pain relief, right, and talk about episiotomies. I'm sure there are some mummies here, or maybe mummies to be, right, who might be entering labor soon, right, hearing some stories about, having to have some stitches, right, after they've given birth to their baby itself, right, and basically, I think this practice of what we call episiotomy, right, is basically a cut, right, that we actually make in the vagina area, all right. The ones that we do here, commonly we do it at the side, all right? So from the center to the side, all right? What we call episiotomy, all right? To basically help, to make the opening of the vagina a bit wider, right? To actually allow the baby to come through more easily, all right? Now, majority of the time, if episiotomy is done, then, obviously it needs to be repaired after the baby is delivered, all right? So most of the time we do that quite easily with stitches, and most mummies actually recover quite well from episiotomy, all right? The wound does heal very well, no major issues, right? It may hurt a little bit for the first couple of days, right? But I think taking some paracetamol usually helps, right? And, most mummies get by with no issues. Now, the question with the episiotomy is that I think in Singapore, for some reason, I think I know in some of the Asian countries, in Singapore, in Hong Kong and in Taiwan, right? From what I'm aware, the majority of mummies, right, do actually have an episiotomy, right? In fact, I think there's some studies suggesting that the episiotomy rate is up to about 90%, right? But certainly in the Western world itself, I believe episiotomy rates, I think majority, of Western societies have suggested, right, that the episiotomy rate should be maybe only about a quarter of women may actually require episiotomy, right? And that has basically led some of our mummies to ask, this question, right? Is episiotomy always necessary for vaginal birth, all right? And I think the important take-home message is that, I would say that it's not always necessary, all right? Now, but you need to be aware, all right, even without episiotomy, all right, 9 out of 10 first-time mothers, all right, will have some sort of tear to raise, all right, and in some cases, episiotomies as well, all right? And in the past, why episiotomies are common is that they were traditionally taught to actually prevent tears, right? So if I go back one slide, all right, now, looking at the anatomy down here, right, the birth canal is actually down in the middle down here, all right? Now, the back passage, the anus is actually very nearby, all right? And the concern in the past is that if the baby is trying to squeeze through this tight opening, a tear may happen, right? That may actually go into the back passage itself, right? And there were concerns. Now, majority of the time, we can actually repair these kind of tears, right? But of course, the concern is whether there could be problems later on, right? Particularly with holding gas, continence issues and all that, right? So in the past, I think, most of us thought, right, that to prevent tears, right, if you make a cut at the side, hopefully the tear wouldn't happen in the middle, right? So this is the traditional thinking, right? Now, unfortunately, I think the research, surrounding this area is, the evidence surrounding this claim is actually quite conflicting, all right? And, even if some mummies, if they have the episiotomy, all right, that cut itself may actually extend into further tears, right? So, we cannot, some of the tears are kind of unavoidable, to a certain extent, all right? So with that in mind, I think not every professional will recommend an episiotomy for every vaginal birth, all right? There might be a few situations where episiotomy may be necessary, all right? And this may include if, let's say, the baby needs to be born in a jiffy, all right? So I think we saw that monitoring the baby's heartbeat, right? The heartbeat is showing that the baby is not coping well with labor itself, right? The cervix is fully dilated, the baby is just right at the bottom, right? So sometimes to get the baby out in a jiffy, right, your doctor may decide, okay, it's a judgment call, I would say, right, at that point in time, that, okay, baby is in trouble, right? We want to get this baby out quickly. Let's make a cut, widen the passage, get the baby out. So this could be a situation, right? Now, there are some mummies who may need a bit of help getting the baby out, all right? Be it because of the emergency, the baby is not well, or some mummies are absolutely exhausted, right? After a long labor, they've been pushing for the last 2 to 3 hours and the baby is not out yet. Now, the baby is very, very low down, all right? And certainly to do a C-section at this point in time will be dangerous for mummy and baby, all right? So in certain cases, we may sometimes need to actually do what we call assisted delivery, which I'll cover in one of the subsequent slides, right? So by use of a forceps or a vacuum to actually help mommy ease the baby out, right? In this kind of cases, episiotomy may be useful to prevent tears, all right? Now, certainly for a mommy who may have had a bad tear before in her previous vaginal birth, right? She's got a tear that's gone to the anus, right, in her last birth, and she's worried, right? Now, certainly in the subsequent birth, the doctor may elect to actually do episiotomy for the subsequent birth itself, right? So I think it's important. I think, as I said, I do advocate supporting mummies in their choice, right? So I think this is also a very important topic that you should be discussing with your doctor, right? I think before you enter labor itself, so that you come to an understanding with the doctor, right? Whether, especially if you have got, you feel strongly that you do not want to have episiotomy, I think it's important to highlight this to your doctor, right? So that there's an understanding, that can be actually achieved with that, right? And I think the key thing is basically manage, to state your expectations, right, so that we can actually help you manage them, right, and so that you won't be overly disappointed if you can't achieve that kind of expectation that you wanted at the beginning. So I think that's very, very important.
And Dr. Tan, you also mentioned
a quick word. Yeah.
So no, carry on. Sorry, carry on.
Yeah,
yes.
Yeah, sure. Yeah. So I think since I mentioned assisted delivery, and Jamie has just also prompted me, right? So basically, I think this is more common, I would say, probably in first-time mummies, right, who's giving birth, right? Because I think a combination of factors, the labor may be actually quite prolonged, right? So mummies may be actually quite tired at the end of the whole labor process, right? She's been pushing for a long time, all right? I would say that depending on the doctor, depending on the hospital, I would say that, about 10% of mummies, I would say in general, right, may require sometimes what we call instrumental assisted birth, right? So basically, I think the important thing, right, you see this picture down here, you might feel a little bit scared, right? What is this big ugly metal instrument that's staring at me down here, right? And certainly, I think to the lay person, right, when you talk about forceps delivery, right, you feel a bit fearful, right? And in our first poll question, right, about mummies wanting the best for their babies, right? Certainly when you see this, you feel a bit comfortable. You mean the doctor's going to put this around my baby's head and try to pull the baby out, right? So I think that's a very common question I do get in my practice. I think the important thing is to remember, all right, we are talking about what we call assisted delivery. All right. So at the end of it all, I think the important thing to know is that it's still mommy who's doing the job. All right. You're not going to be yanking the baby out, so to speak. Right. The idea of putting a forceps on is basically to help to guide the baby in the right direction. The majority of the time is actually mommy that's still doing the work. So mommy must still be able to push well and be able to cooperate well. Right? And the idea behind using either a vacuum or a forceps is to basically help mommy just get that extra little push, right, to get the baby out, right? So I think we're not going to yank, forcefully, right? It's just basically to guide the baby in the right direction, to give mommy so-called a small little boost to actually achieve a normal delivery itself, right? And why is this sometimes needed, right? For mommy, as I mentioned, right, some mummies after a long labor, they could be too tired to push the baby out, right? So that could be a concern, right? She's been pushing for so long, right, that you're concerned that sometimes for us as professionals, we're concerned, right? Mommy has been pushing for 2-3 hours already, right? Even if she's got the energy to do so, right? There's a concern that this long labor process may put them at risk of actually experiencing heavy bleeding after the baby is out, right? So sometimes we want to shorten, that stage a little bit, right? So sometimes we may advocate assisting mommy a little bit, right? Or if mommy is not pushing the baby well at all, right? And certainly for baby itself, a lot of times where we do need to do instrumental delivery will be in cases where the baby's immediate safety, right? There's a big concern. The heartbeat has dropped all of a sudden, right? And the baby's just right there. You just want to get this baby out as soon as possible, right? So that the baby can start to cry, breathe on its own, right? And so no longer dependent on mommy's placenta circulation, basically. All right. So I think just a very quick word about that, right? But I think it's important, right, to know. I think the important take-home message I have for every mommy here is that it's an assisted delivery, all right. So we are not you're not going to yank the baby out with without any effort from mommy itself, right? The majority of the work is still being done by mommy, right? And the idea behind this is just to guide the baby out in the safest way possible.
I think this is all fantastic, Dr. Tan, because of the fact that, like we said, you need to be informed, right, and prepared. And when you manage your expectations and you know what's coming, then you're more prepared, there's less fear, and there's more oxytocin flowing. If you guys want to know what oxytocin is, go read it up. It's that magic thing that happens with your body, that helps you to get into labor quickly and fast without all these forceps and, vacuum assisted delivery. So I think that this is really important. Thank you so much, Dr. Tan. Maybe you can take us through what we can do to prepare for hospital for our hospital bags in such a, you know, in a scenario like the COVID-19 situation. Yeah, that would be, you know, I think really helpful for most of our viewers. Yeah.
Yeah, no problem. Yeah, I've actually got a slide, you know, with regards to C-section, but you know, I think this is just basically just saying that, you know, why are the reasons that some women may, you know, require a C-section, right? But I think, you know, it's always good to discuss with your doctor. But in the interest of time, I think I'm going to move on, right, about our hospital, you know, bag checklists, right, especially with the COVID situation, right? But I think this is quite self-explanatory, you know, but it's certainly important, right? Because I think with labor itself, not all labor ends up with a successful delivery. So a C-section may sometimes still be required, right, even though it may not be your first choice at the beginning, right? So I think it's important to understand some of the things that can happen. Right?
Yep.
Now, so I think with regards to a hospital bag, you know, checklist itself, I think essentially not much has changed, right? Right. Certainly, I think what mummies used to bring to, you know, the hospital itself will still apply, right? But of course, you know, we've added a little bit of post-COVID-19 kind of adaptation, right, to, you know, the way the situation is
extra
actually developing.
masks, sanitizers, no doubt.
Yeah, right. I've taken this from one of the private hospitals, I think from their webpage, right? But I think a lot of them are basically some basic necessities and comfort that you might want, right? Obviously, some comfortable clothes, right? Slippers, you know. Certainly, I think, you know, some disposable underwear is important, some toiletries, right? For mummies who are very keen to start breastfeeding, you might sometimes want to bring your breast pump if you have bought one, so that the nurses can actually show you what to do, right, with the pump itself to guide you along the way. There are some mummies who would like to plan, you know, in advance, right? So they want to plan, you know, they want to feel good when they're going home on the journey home with baby, so they have got a going home outfit for both mummy and baby, right? Now, I think for a mummy who's entering the labor ward, certainly it's important if you've got a birth plan, you know, you've got some things that you want to be done during your labor process itself, that hopefully you have discussed this birth plan with your doctor, but it's certainly important for you to bring this birth plan along, right? Because
and
of
print
course,
copies,
there'll be other people
copies.
yeah, printed copies, yes, right? Because certainly apart from the doctor, there's a whole team of other people looking after you, anesthetists, as we mentioned earlier on, the midwives, right? You know, the nurses and all that. So I think it's important, right? So that we are all clear, you know, about, you know, what are your expectations for the labor itself. Now, certainly some of the, you know, humdrum things with admission, right, with regards to the documentation, right, bring these items, right. Now, I think certainly, as I mentioned at the beginning, right, concerns about, you know, needing a swab and all that, I think you do need to find out from your hospital, right, they're going to deliver, right, that, you know, in the current situation, who needs to be swabbed at what time, you know, when and all that, right. What are the costs involved as well, right, because I think there are certain swabs which are complementary, right, but certainly I think for the husbands, right, and
yes,
the,
it might be
know,
chargeable.
swabs,
You're absolutely right. For parents
now,
out there,
certainly,
I think, sorry, Dr. Tan, could you go back one slide?
Sure, no problem.
For the parents out there, you know, do take a picture of this. If you'd like to, you know, start it on your phone, you know, so you can pack, you know, if you are in the midst of packing right now, you know, to get your bag ready. And I also like to add, you know, that I think snacks are really important for daddies because daddies have to wait quite a long time. I've had daddies like actually, you know, go on gummy bears, you know, just to keep their sugar levels up. And it's really lovely when, you know, daddies are all fueled up because they can actually support mummies better. Yeah, and do have a playlist as well if you have one, because I think all that soothing music might actually help the two of you. You know, you have to set the mood for birth, right, Dr. Tan? Yeah.
I think with the gummies itself, I think it's quite tricky, right? Because I think recently there was a press article, right, about a reporter observing that, you know, people eating in the wards without their masks and all
that's
that.
Right.
Yeah, so I think it's good to bring. I wouldn't deny the fact that it's good to bring, right? But do find out from the hospital staff whether you're allowed to do that, right?
Do a quick one under the mask or something, right?
Yeah, correct. Yeah, so I think certainly something to take note of, basically, right? And
great.
as we mentioned earlier on, you know, in our current situation, right, you may want to stock out on some of these things right along the way.
Yes.
Now, I think it's important to be prepared, you know, with your hospital bag, right? But also, right, don't be over prepared, right? Don't pack the whole, you know, your whole house with you, right, when you enter the hospital itself, right? Because sometimes, right, you know, you might actually go home earlier than expected, right? So I think do consider, you know, packing. I think, you know, don't overpack, right? But don't pack too little as well, right? So I think, you know, do it in moderation, basically. All right.
Yeah, Dr. Tan, there's just one
Okay.
last thing that I
Yeah.
have for you.
Yeah. Yeah.
And I
Yeah.
think there's a lot of research and strong evidence showing that babies benefit from delayed cord clamping, because you mentioned just now,
Yes.
about delivery and all that, and or waiting for white, when the cord stops pulsating because baby receives a maximum amount of, blood volume from the placenta. So
Yes.
maybe you could give us a little bit of background on cord blood
Mm.
banking. That is like a tongue twister. Yeah, cord blood banking. Yes.
Okay, I mean, cord blood banking itself certainly not something that is new. All right, I think if I think in the past before the pandemic, I think if you go for baby fairs and all that, you will see a lot of commercial companies, all right, approaching you, about this topic about cord blood banking. All right, and the idea behind cord blood banking is simply a collection of the blood, all right, from the baby's umbilical cord after the baby is born, right? And what is done with this blood sample, with this blood collection, is that it's actually sent, and basically frozen, all right, for further use in the future, right? And I think the common application for that is actually to be used to treat, childhood cancers if they do unfortunately develop at some point in time, right? So I think that has been the main stay, all right, of cord blood banking. Now, of course, the commercial cord blood banking companies may also tell you that, along the way, right, because a lot of this is actually being researched at this point in time, right? Now, so for most of the cord blood banking, the general advice is that you bank the baby's blood for the next 21 years until the baby is of adult age, right? And the idea which has been suggested is that, well, in this next 21 years, for all you know, right, the stem cells that they can get from cord blood may be used for other treatments, right, for diseases in the future, right? So in a way, it's like an insurance policy, right? You hope not to use it, right? But if you want to use it, at least it's there for you to use in that sense, right? So I think that's how the majority of the commercial cord blood banking companies will actually approach you with this idea. Now, certainly, I think in Singapore itself, apart from the commercial cord blood banking services, there's also National Cord Blood Bank itself, right, where actually the Singapore Cord Blood Bank, right, where they will actually approach mummies, right, to see whether if they'll be willing to actually donate their cord blood, right, because this cord blood may sometimes be used for treatment of children with leukemia. Right, so there's actually a cord blood bank that's set up for that purpose, right? So I think at the end of it all, it's a very personal choice, all right? It really depends on what your views are with regards to cord blood banking. There are some mummies who say that I don't foresee that I will use this, right? I'm not keen to do a commercial cord blood banking. I would like to donate the baby's cord blood, right? Certainly, I think you're happy with that. I think that's perfectly fine, right? But there are certainly some mummies who say, okay, I may need this cord blood in the future, right? I'm going to have more children, perhaps the siblings, in the future, if touch wood, if they develop some of these diseases, right? Perhaps the cord blood can be used for the siblings, in the future and all that. So there are some parents who may then choose to actually go with private cord blood banking in that sense, right? So I think essentially, again, I think it's very important to explore, right, with your doctor at some point in time, right, before you go into labor, to also discuss with the companies, right. Obviously, there are some costs that are involved, right. There's usually a kind of an entry fee, so-called upfront fee that you have to pay, and then there's kind of an annual fee that you might have to pay for the next 21 years for this baby. I think the fee itself can be subsidized from the, from the baby bonus, that most Singaporean mummies will receive, so I think there's a certain amount that you can actually deduct, right. But certainly it's important to find out, the reasons why you want to bank the cord blood, right? What are the costs involved? What is the procedure? What's the process involved as well? Now, certainly, I think with cord blood banking, I think there are concerns, right? Whether if the COVID-19 pandemic has affected this practice. I think thankfully the data suggests, that even if the mother has got COVID, right, the baby's cord blood is unlikely to contain the virus, right? So in a way, it's not a contraindication to actually banking the cord blood, right? There are some studies have also suggested, right, that both the amniotic fluid and placenta are similarly not affected. So I think some data suggesting that hopefully whatever you choose to bank may not be affected, right? So I think the take-home message is that collection of cord blood at delivery still remains essentially safe, right, for most mummies. Right, so I think now, of course, I think Jamie mentioned with regards to delayed cord clamping, all right, and I don't think that there's a problem, all right. So essentially, the practice of delayed cord clamping is basically to allow the blood, that is within the cord, within the placenta, as much of it to actually return back to the baby, right, before we actually cut, the cord itself, right. Now, certainly, I don't think we should let this practice actually, we shouldn't let, doing cord blood banking, all right, override, the importance of a delayed cord clamping, all right? And certainly, I think even if we have waited long enough for the blood to go back to baby, there's usually still, a fair amount that we still can harvest, right, from the cord, right? For that banking purpose, basically. Yeah.
Thank you so much for that presentation, Dr. Tan. There's so much information in there. I know parents were asking a lot of questions, right? So we have a lot of questions to actually attend to. Is it possible that we can move to Q&A so that we can actually move to...
So just one take-home message from everyone, right? I came up with this last night, I think, when I was updating my Facebook, right, to promote this talk itself, right? I think this is a very important take-home message in our current times, right? Do keep calm and stay safe, all right, for your baby, all right? And if there are any concerns, obviously, it's good to discuss with your doctor along the way. I know there's a lot of uncertainties for us as well as professionals, right? We are basically also going with the flow. A lot of things that is coming out, a lot of guidance that's coming out for us. The rules do change every day, all right? So I think it's important to find out, right, before you go into labor. I think the best way to be prepared for labor itself, right, is to make sure that that you are informed, right, to the best of your abilities, right, so that when you go into labor, it's not going to be a kind of a culture shock, a root shock to you, where everything is totally unexpected. So I think empowering yourself with the knowledge is certainly a very important thing that you need to do before you deliver that baby.
Certainly. And okay, so we've got a whole number of questions, Dr. Tan. Guys, thank you so much for giving us your questions. We've unfortunately only got time for one or two of them. So the first one that we have is with cervical circlage. I think I'm pronouncing this correctly. With cervical circlage and low blood, can I still go for natural? And I think this is one of the moms who's asking us this question.
Okay, I think the term is actually cervical circlage, depending on how you pronounce it. Okay, just for the benefit of everyone here, a cervical circlage is basically a stitch, all right, that's actually placed in the cervix, all right. The usual cases when mummies may require a cervical circlage, right, is because of the fear, all right, that the cervix may not be strong enough to actually support the pregnancy. Right, so most of the time, what happens is that the mummy who receives a cerclage might have come in with a previous pregnancy. She may have lost a previous pregnancy, all right, at a certain stage, right, which suggests that the cervix may be weak. All right, the cervix may be sometimes naturally weak, but certainly there are some people who may have gone for surgeries in the past, treatment in the past that might have actually weakened the cervix, right? So in the process, the cervix becomes weakened, and because there's a lot of weight, there's a lot of stress that the cervix has to support, right, during pregnancy itself, right? So there's a concern, right, that the cervix may actually give way, right, in the subsequent pregnancy. Right, so in these kind of cases, right, usually it's a discussion between the doctor and the mummy. All right, what happens basically is that at a certain stage of the pregnancy, right, depending on how the situation goes, I think once the mummy is comfortably in her second trimester, right, some doctors may advise, right, that because of the previous past history, right, that the cervix might be weak, they may actually put in a stitch in the cervix itself to kind of tighten things to prevent premature delivery. All right. So I think the purpose of that is obviously to make this pregnancy carry on to term as far as possible. All right. And certainly, I don't think a cerclage is a contraindication to having a vaginal birth. Typically, what happens is that if this pregnancy managed to go to term, all right, which is from 37 weeks and above, right. Now, most of us would actually cut the cerclage around about 36 weeks. And then see what happens after that, right? And if the cervix is naturally loose, no problem. I mean, because you want the cervix to open anyway at that stage, right? So that the baby can come through, right? So I don't think it's a contraindication to having a vaginal birth. Now, as to the second part of that question, where we're talking about anemia in mummy, right? It really depends on the degree of anemia that mummy has. I wouldn't say that anemia is actually a strong indication to have a C-section delivery, right? Because at the end of it all, now anemia, the blood is low, right? So the concern is that we do not want mummy to actually lose too much blood during the birth process itself. Now, if you think about it, vaginal birth and C-section, right, both carry equal risk, right? Sometimes some people will even argue that a C-section carries a higher risk of bleeding, right, because you need to cut through tissues and things like that, right? So, in fact, it's probably good to have a good discussion with your doctor to decide, right, what, is best for mummy, right, with regards to that. Now, as far as possible, if a mummy is identified to be anemic, right, we hope to actually pick that up early, all right? So most mummies, at the end of the first trimester, they will have their pregnancy bloods taken. That's usually one of the first encounters where we may sometimes pick up anemia in mummy, right? And we do pick up anemia, we do encourage mummy to basically, take supplementation, right? Take iron supplements to build up their blood counts, right? For some of us, we may actually repeat a blood count around about 28 weeks to 30 weeks, thereabouts, to again pick up, right, whether anemia has developed along the way, all right? Now, the reason why we do it around about 28 to 30 weeks is that it gives us a bit of time allowance. So if we do pick up a mummy who's anemic at that stage, right, there's still another 6 to 7 weeks more to go before she reaches term. That gives us a bit of time to actually supplement the mummy, right, with enough, iron, and hopefully build up their iron stores naturally so that we can correct the anemia. Now, certainly if a mummy is coming in about 36 weeks, 37 weeks, and she's still severely anemic at that point in time, then in these kind of cases, sometimes a transfusion may be necessary, right? But I don't think, that being anemic, right, means a C-section.
Doesn't necessarily equate. That's what you're saying.
Yes.
Right.
Yes.
Okay. Do we have time for one more question? Okay, right. Let's take one more question now. This one's a quick one. So, Dr. Tan, question about epidurals. Yes.
Okay.
Why yes, why not? What are the pros and cons, and when is the best time to actually take an epidural?
I think at the end of it all, there's no right or wrong, right? It is a very personal choice, right?
Yes.
I think that's a recurrent theme, right? Because I think certainly we have heard some of our mummies, right, who say that, I do not want to have epidural, right? So I think there are some misconceptions about epidural. Some of them may have actually been passed on by, the older generation, right? So things like, for example, you may hear from your mummy, you may hear from your mom-in-law, right? That having an epidural is a bad thing, or you're going to end up with a long-term backache and things like that. Now, certainly, I think the research has suggested that, those are more myths rather than truths, right? So which is reassuring, all right? Yes. Now, of course, I think the epidural is important, all right? For mummies, especially if they are afraid of pain. All right. I would say that also if mummy is expecting a very long labor, having an epidural is actually a good idea, right? Because it does take away most of the pain of the labor process itself, all right? Allowing mummy to get that rest, right? So that she can conserve energy for that final stage where she's starting to push the baby out, right? So I think that's an advantage with that. But certainly I think with epidurals, it's not without its own complications, all right? Complications rates are thankfully low, right? But I think there's always a concern, right? Because you're doing an injection at the back near the spinal cord, right? So there's always a concern, what if an accident happens? What if I get an infection, right? There are some women who, after having an epidural, may actually develop a headache, right? Because as a complication of that process itself, right? But thankfully, I think the majority of these can be actually treated. Now, we do know that mummies who undergo epidural pain relief for labor itself, they are also at a slightly higher risk, right, of requiring instrumental delivery, right? The forceps and vacuum that we talked about earlier on, right? Simply because of the fact that, because sometimes the epidural is so effective that, the mummy can't even feel the pain
enough to push.
Right?
Yeah, that's right.
To push, yes. So that sometimes gets in the way of things, right? And, if the mummy can't push very well, then, no choice, right? The baby is very low, right? We may have no choice but to sometimes recommend instrumental delivery, right? So I think there are pros and cons, definitely. And I think it's important, to explore these, with your doctor, going to labor.
Okay, thank you so much, Dr. Tan. I just want to say that we've had so many questions today, and I want you to know that not to worry, we will get the answers to your questions because these are very pertinent and important questions. And do check our Facebook page for updates. All right. I've promised our viewers, Dr. Tan, I've promised them a surprise, right? So we've actually got a $3 Shopee voucher with no minimum spend on toys, kids, and babies category products. So all you have to do is just get that phone camera, right, and scan the QR code to claim your voucher. Okay, so don't forget these vouchers expire by 23rd of May. So scan away, guys. Thank you so much, Shopee, for this fantastic gift for all our viewers. I'm sure mummies and daddies alike are so excited about this little gift. The shopping for baby is the best part, right? Usually that's the pinnacle, right? So, parents, I hope, today's webinar has been insightful. I know it has for me. A very big thank you to Dr. Tan for such an insightful talk and presentation. And to all of you who attended this webinar and joined us today and made it such a success. This is the first of a series of webinars as a part of the Singapore Parenting Festival, which is proudly presented to you by MediaCorp and the Asian Parent. Now, this festival is made possible by the following key partners: official e-commerce partner Shopee, Platinum partner Walsh, Gold partners GSK Scots, Dumex Dugro, Nestle Milo, Nature One Dairy, our silver partners, Abbott Similac, Pampers, Nestle Nan, and our content partners, Center for Fathering, Mums for Life, and Dads for Life. So thank you so much for being a part of today's webinar. I hope you've enjoyed it. And please do participate in our next webinar, okay? It's on maternity insurance and confinements guide, okay? So it's a guide for the postpartum, yep. And also what you can do to prepare for maternity and for your pregnancy, right? So it takes place tomorrow evening at the same time, 7:30 p.m. to 9 p.m. Singapore time. And remember to visit us at SPF 2021, theasianparent.com, to find out more about exciting contests and grand sales during the festival. Do take care, stay safe everyone, and bye-bye.